Hi, Vanderbilt Lifelike community. This is Jerry Jones, and today we're talking about a really important topic. With me is Jim Kendall. Jim is the manager of the Vanderbilt University Medical Center Work-Life Connections and here at Vanderbilt. So Jim works with all of our employees, and interesting thing to note, Jim has been working with the EMS community for a long time. He helped set up the critical stress incident debriefing program in Tennessee. Uh, many years ago. And so he's very familiar with EMS and the first responder community. So welcome, Jim. Nice to
Thank you,
have you.
Jerry.
And
I'm proud to be here.
today we want to talk a little bit about a couple of topics, but the first thing I want to talk about is the social stigma associated with the COVID-19 virus. And so a couple of things on that. I'm hearing from some of my colleagues in the first responder community that if an EMS, fire, police, 911 worker, if they do test positive, it comes with a lot of guilt feelings that they're not able to stay out and be on the front line and help their colleagues.
Yeah, I think one of the things that we as a society tend to look at is we would like to assign blame on somebody for getting something like this because it helps us feel like, oh, that can't be me, and so it's an unconscious feeling, but it is there, and when it becomes us, we start to feel like, oh, I wonder if I was careless, did I do something, and now I worry, did I infect a patient? Did I have contact with one of my coworkers and they're going to get it? And you feel shame almost. And so I think one of the other things that I've learned about EMS folks is this complete dedication to the community. And so for each person who contracts that and is saying, oh, now I've got to be home, there's a guilt that I'm not able to help my coworkers and help the community and be there. And so it's this double whammy of both guilt and shame that I think happens.
And what can we do about that? What's your advice, to our professionals across the state?
So my advice is to take what we know and tell our patients seriously, that we know that there are certain things that we can do. We can wash our hands, we can wear the gear that we need to, we can do whatever social distancing we can do within the jobs that we do. And if we're not feeling well, we need to stay home because we don't need to pass this on. On the other hand, the thing that we have to take in terms of advice is the same that we would give somebody else. We would tell our patients, this isn't your fault. This is an illness that spreads rapidly, and that we all take the precautions we can, but we have little control in many ways about what's out there. And especially when you're on the front lines, you are faced with situations where you take a little bit of risk sometimes because you are saving patients' lives, and you're just hoping and praying that you're going to be okay and doing the things that you know to do.
Right, and I know everyone's acutely aware. We're doing a lot of screening questions to ask. We're masking patients early. I mean, everyone's taking the precautions, but that doesn't necessarily mean that they're not going to, get the virus.
That's absolutely true. And for some of us, we still have to go to the grocery store and get toilet paper if we can find it, get our wipes and anything else that we need. And so what we recognize is, yes, we are all subject to being in contact with somebody. So we have to be smart about it. And we also have to think of this, and this is no surprise to everybody. This is a marathon. this is going to be happening for quite some time. This is not going to go away in a couple weeks. We hope that it stays level, but what we know is the studies show that this is going to be around us for a while, and we're going to have to take this to heart on a regular basis and keep supporting each other.
So, Jim, are you saying that you're a little concerned that some fatigue could set in and we start becoming lax and not really careless, but it just becomes the norm?
What I'm thinking is this is going to be kind of a COVID-19 fatigue, that we are going to become a little desensitized in one sense, because it is, if you are home and trying to relax and have the regular television on, or you're listening to any station, about every hour, if not every minute, you're hearing updates. Now, the updates don't change a lot, but we're hearing it. And so what we know is when we're bombarded with something over and over again, it can drag us down. It can create an extra depression for folks. And it can also just drain us, because in your daily work, you are thinking about this for your whole shift. And then if you go home and you're bombarded with it when you're trying to relax, that makes it doubly hard. That's why some of our streaming television outlets are really helpful, because they cut out that time where we are bombarded in the regular stations of hearing this news over and over again. And it doesn't change from hour to hour, but we keep being reminded of that right before we go to bed. They've now added 10:30 shows at night, so that you get the coronavirus information right before you're trying to go to sleep, if you are lucky enough to be on that schedule. And so it happens all the time.
So you think it's really important to disconnect for a little while from
I love media, but I believe it's really important that we disconnect from certain activities and be intentional about it. We also need to be intentional about self-care. And I know that doesn't sound like, super stuff, but we need to make sure during this time when gyms are closed and exercise is a great coping mechanism, we need to try to get outside, keep our social distancing, but do some walks, do some runs. You can exercise at home, but they are things we need to keep doing.
Right. And gosh, it's so important to disconnect. And I'm hearing from colleagues that it is really hard to sleep at night. Some of them have nightmares. They're worried about their finances, everything. They're stress eating all the time. And so it's really, it is taking, its toll on our mental health, I think. So let's talk about, Jim, about the social stigma that's coming with this. And it's really affecting a lot of our healthcare workers and our first responders. In that, when I was doing research for this topic, the CDC says that our frontline workers, our healthcare and first responders, are among some of the top that experience the social stigma, including potential violence.
Yes.
And I didn't think about that, but it really surprised me.
I was surprised to see that or to hear that, because to me, our frontline healthcare workers and all the folks that support us are our heroes right now.
Right.
They are people who are willing to put the community greater good ahead of their own safety, and in some respects by having more contact. And so it always surprises me that you see pockets of people who may not be educated about how important it is that our healthcare folks are coming to work and taking care of folks, and also how important it is that we plan this in ahead so that we're not having everybody report to emergency rooms and departments, but instead we're using the proper outpatient resources to protect the hospitals for the serious cases.
And I do know everyone's taking precautions so that they don't carry this home with them if they get it home with them. You know, they're decontaminating their ambulances, we're decontaminating aircraft, you know, the treatment rooms. And so I think the public needs to be reassured that we're taking all those possible steps. But I even heard of a colleague that was in their scrubs, and they walked into a grocery store and some woman screamed at them, you know, get away, you're carrying the virus.
Yeah, I've heard that, and I hope that we don't have that kind of ignorance, pardon me, but around the places where our folks are. Instead, we should have people thanking us and saluting us for the work that you do.
So let's talk about what are some of the things we can do to help with the social stigma. I know education is a big part of it.
I think education, and certainly celebrating the times that you are able to help people who are in dire straits from needing to go to an ER because of the work that you do. People are still going to get into wrecks. People are still going to have these issues, and we need to celebrate the fact that our EMS are willing to be on the front lines.
That's right, because we can't forget that everything else that goes on is still going on.
Yeah.
Right.
And as much as we ask people to social distance, not everybody does. We know that there is the financial stress that's out there. And that's going to be with us a while. These are emergent times. We are in an emergency management time right now, and there's not much we can do about that.
So I just need to wrap this up, Jim, but is there anything else you want to talk about for our first responders and their mental health? Any kind of tidbit or?
I want to remind you that this will pass. This is not a permanent condition, but it is a condition that will be with us for a while. And as we get on the other side of this, we are going to be looking back at this as a real milestone in a career. I think, you know, when you've survived and thrived, as many of our EMS departments are going to do during this time, and figure out how to pull together, it is going to hopefully make us stronger. And also, I think it will be kind of that badge of courage, as I was able to get through that. Now, that doesn't mean that you might not, you may be one of the people who is living and dealing with the illness for a while, and on the backside you'll say, it was awful, but I got through it, and I'm able to get back to work and do what I need to. But it reminds us of the power of little tiny viruses, and we'll never take them for granted again, I hope.
And that fear of the unknown.
Yes. And so you can only control what you can, and we have to recognize it is normal to worry, it is normal to have anxiety, but we need to temper that with the facts that we know, and use our education to guide us.
Great. Well, thank you, Jim, for joining us today. And I know the Lifelight and the first responder community appreciates all your hard work.
And I appreciate all of you. Thank you.